Good morning. I'm Dr. Edgar Stewart, and I'm joined by my colleagues Sharon Powell and Yvonne Smith for the 2021 OSSE Non-Public School Start of School webinar. I want to just do a sound check to make sure that you all can hear me. So if you will please use the chat box to just let me know that you can hear me okay, and I will attend to that. Okay, sound check. Please use the chat box. Okay, so I saw someone use the questions, and okay, folks are using the questions, and yes, great. So you all can, it appears that you all can hear me. Okay. All right, so we are going to get started. As I said, welcome. So we're first going to do introductions. We will be then reviewing the status of the public health emergency and public emergency, reviewing COVID-specific related topics, ongoing non-public school compliance operations, and then wrapping up with question and answer. However, even though there's a Q&A at the end, please feel free to stop us and use the question box to type in your questions. And we will be monitoring those as we go through. You will also notice in the handouts interface, there is one handout, which is a copy of this PowerPoint presentation. We'll be sending it to all attendees afterwards as well. But if you want to follow along with us, and write notes, feel free to use that as well. Okay. So as I said, my name is Edgar Stewart, and I am the monitoring specialist working with the non-public support team. Recently, we had a realignment of the non-public monitoring team, and we were realigned into two separate teams. They were created and realigned in just over a year ago in October of 2020. And Sharon Powell, who many of you have interacted with already, is heading up the non-public systems oversight team. And that team is working on typical day-to-day operations for non-public schools, including renewal and initial applications, as well as annual assurances and on-site monitoring visits, and then a correction of any non-compliance, as well as incident report reviews. I'm heading up the non-public support team, which looks at more investigations for non-public schools, more in-depth investigations for non-public schools, provides non-public technical assistance and support for non-public schools and LEAs, and also is involved in any kind of policy analyses or support and dissemination. Joining us today is Yvonne Smith, who is the manager of two teams, the non-public payment and invoice unit, and also the Medicaid recovery team. So we're pleased to welcome today non-public schools, MANSEF, as well as our LEA colleagues as well. So this just gives you a little bit of an overview of the role of both teams. As I said, on the non-public systems oversight team, there are activities including COA applications, like I said, routine on-site monitoring, routine desktop monitoring, the first round of reviews for incident report reviews, conducting annual assurance reviews, and then coordinating with other agencies as well as within other teams within OSSE. On the non-public support team that's led by me, we investigate allegations and complaints, and these are for any response to incidents or concerns that are raised by either non-publics, community stakeholders, or our LEA colleagues as well. We're involved in policy and regulatory matters, in terms of looking specifically at the Seaway regulations and any revisions that need to be made and any other policy matters affecting non-public schools. We take that information and along with other areas of training and support, provide technical assistance, develop webinars and professional development, as well as print material. And we're involved, as I said, in the incident report reviews when they get to a kind of second, more intensive level in terms of identified concerns. And then finally, we're involved in engaging in oversight for our non-public schools for any emergency activities, including hurricanes and or things like the COVID exposure or programming for COVID. So next we're going to move into looking at the public health emergency, and public emergency. These are mayor's orders that have been published over the last 18 to 20 months, dealing with various aspects of this COVID pandemic. And there's a lot of information that is contained in those public health emergencies, but we wanted to review only that information that's relevant to non-public schools. So per the July 24th of 2021 mayor's order, the public health emergency was terminated starting on July 25th. The public emergency, which is slightly different, ended on October 8th. However, what we wanted to flag for you from the public emergency was that the district government will continue to respond as appropriate as it relates to public health and safety issues that arise because of the pandemic, and in that sense may affect school operations. And as issues and concerns come up, we will be providing guidance forthcoming. Specifically, in terms of the public health emergency, the major implication for non-public schools is that there had been a license waiver for those schools located in the District of Columbia who are certified by OSSE, those non-public schools certified by OSSE, for their teachers and their related service providers in terms of expiration dates on their licenses. That waiver ended with the public health emergency on July 25th, and 45 days from July 25th, all DC non-public school teachers and related service providers needed to have current licensure. So that is the primary implication of the public health emergency as it relates to non-public schools. Some kind of past activities related to the expiration of the public health emergencies is that OSSE began in June of 2021 to resume our on-site monitoring visits. So many of you either who were scheduled to receive on-site monitoring visits in the 2021 school year, and those who are slated for the 21-22 school year have already been in contact with us to either set up visits, or we've already conducted those visits, and those will continue. As I said before, DC license holders, including both teaching and related service providers, their credentials must be current as of this past September 9th of 2021. Attendance reporting as it relates to seats for this upcoming school year, so this school year, the current school year we're in, should be completed in accordance with the guidance that we'll be providing later in this presentation. All right, we're going to be moving into COVID-specific topics. As many of you already know, OSSE has been engaged very actively in disseminating information relevant to non-public schools and LEAs on the OSSE website. The link down here at the bottom, updated OSSE guidance documents, includes information in these various areas: health and safety resources, enrollment processes, assessment and accountability, guidelines for principles of continuous education. So if you visit the OSSE website, and in the version of the handout that you received, those are all active links, so that you can go to the OSSE website, and really we encourage you to visit that website often, because there are ongoing updates that we provide either to the existing documents or as new information and new guidance comes out. We also endeavor to send that information directly to you, but we encourage you to go to the OSSE website, to this guidance page, so that you can make sure that you're in the know about the most up-to-date guidance from OSSE as it relates to kind of COVID-specific topics. All right, I'm going to pause for a second because it looks like I'm getting a number of questions raising concerns that they are no longer able to hear. For my colleagues, Yvonne and Sharon, are you able to hear me, since your microphones are not muted?
Yeah, I can hear you.
Okay.
I can hear you.
All right. Let me just make sure. Okay. It looks like what folks are saying is that those folks who are joining through the computer may be having sound issues, but the using the dial-in phone number, you seem to be able to have no trouble getting sounds. So I'd encourage all of you to use the dial-in phone number rather than online.
Or switch to headphones. That's like what
yeah.
I had to do.
Thank you.
Switch to headphones, and the audio might work better for you. I had to do that myself.
Okay. All right. There's a question here, and I think it relates to what we already shared about the licenses. So I wanna resume by answering this question, and I'll read it out loud. Are you aware that non-public schools outside of DC, for example in Maryland and Virginia, are currently unable to provide related services to DC students unless we hold licenses in DC due to the emergency telehealth mandate ending on September 23rd? So the short answer is yes, we are aware of that. Do you have any guidance for provision of these services to these students? At this time, we have no current updated guidance to address this issue. We're very aware of it, and non-public schools who find themselves in this situation, please reach out to us and let us know your concerns in this area so we can compile this information to provide it to our leadership. We are currently working with the Department of Health to let them know the extent to which these issues are affecting related service delivery. But I think one of the first things that we need to be able to do is to catalog those situations where virtual instruction, well, primarily virtual related service delivery needs to occur. And typically these have been in situations where students have been identified as COVID positive or come in contact with somebody who's COVID positive, and out of an abundance of caution have been requested to remain at home and receive instruction and related service delivery virtually. So again, please reach out to your non-public monitor, and that's LaShonda Wilson or Tony Lemons, and let them know about your concerns in this area so that we can catalog that information and make sure we we share that with our leadership.
And Edgar, this is Yvonne. Can I add that, you know, in this situation with providing services virtual, you basically have two scenarios. You have students who may have to go virtual for quarantine, which is a temporary time period, then students who might have gotten a waiver for medical reasons or whatever. Just also keep in mind for those that are quarantined, yeah, if you don't have a DC license, you can't provide the services, but you can do makeup services, you know, once the student comes back. And this situation should be more problematic for those kids who have a longer term waiver to receive services virtually. So don't forget, you can still do makeup services at a later time if you don't have that DC license right now.
Yeah, and unfortunately, that's all the guidance that we have at this time for you all. Okay. So if you all, many of you all recall from last year, we requested that non-public schools complete a questionnaire, which gives us information as it relates to your COVID precautions, including, you know, the same things that we've been talking about. How do you address situations where students have been identified as either COVID positive or exposed to those with COVID? What kind of mitigation strategies do you have in terms of ensuring, you know, a reduction of, you know, exposure kind of risk, including, you know, masks and social distancing strategies. So we're asking that by November 1st, so basically within the next 2 weeks, you follow the link that can be accessed here in this slide. And again, you all will receive a copy of this if you haven't already downloaded it from the interface. We ask that you complete the questionnaire for the 2021 school year, and we will be tracking that to make sure that we have responses from all non-public schools. In addition to completing the questionnaire, OSSE requests that by November 1st, that you also submit continuous education plans to OSSE, to your assigned monitor, and to your local education agencies of the children that you're serving. Now, we're already aware that many of you have been doing this and have already been in contact with your LEAs who you've been serving, you know, since the beginning of the school year to provide this information. But in the event that you haven't completed that, OSSE requests that by November 1st, that all continuous education plans be sent to any of the LEAs that you're serving, along with your assigned monitor, and that's LaShonda Wilson and Tony Lemons. So I think we had a little bit of a typo here. The continuous education plans are due by November 15th. The non-public survey is due by November 1st. So there's additional information on the components of the continuous education plans. You can find those in both of these documents that are listed here. The SY 2021 continuous learning and school recovery plan, as well as the OSSE guiding principles for continuous education. Okay, we're going to switch to talk about key regulations, COA regulations, in terms of non-public school safety measures. But I'm going to pause here because I see a couple of questions I want to make sure that we tackle before we move on. From what governmental authority would related service licensing future guidance come from? Is it a DC health issue because of licensing? The issue, so ultimately, with regard to those non-public schools that are located in DC, the issue will definitely come from the Department of Health, and OSSE will be passing on that information as it relates to non-public schools within the district. We're working with DC Health and several other agencies when it comes to looking at kind of larger guidance as it relates to serving students who may be at the time of receiving related service delivery located in the district, but whose licensed providers are coming from other states. So I guess the short answer will be that given that we understand the implications for our non-public schools located outside the district, that we will be pushing that information out once we get it, should we get any updates to the current guidance. Okay. Will DC participate in the interstate compact for OTs and SLPs? I'm not specifically aware of what that compact stipulates, but at this time we have no information about related service providers outside of the District of Columbia providing any services to students within the District of Columbia. All right, I'm going to turn it over to Ms. Sharon Powell for talking about the non-public school safety measures.
Thanks, Edgar. Good morning, everyone. This is Sharon Powell with OSSE's non-public system oversight team, which today is comprised of myself, Tony Lemons, and LaShonda Wilson. So in this part of the presentation, we'd like to remind you of some of the long-standing requirements related to health and safety that are laid out in our district regulations, and that have been in effect since the regulations that govern the operation of OSSE-approved non-public special education schools and programs were first promulgated back in 2006. So here we see that non-public schools are required to regularly undergo fire and safety and health and sanitation inspections and hold current and valid inspection certificates. We do honor any COVID-related waivers that other jurisdictions may have granted. However, we are seeing that a lot of times those periods have ended. So we're seeing fewer and fewer of those that remain in effect. Next slide, please. So here, non-public schools are required to report, as a reminder, all cases of suspected neglect and or abuse to the appropriate external authorities. Non-public schools are required to ensure compliance with IDEA's discipline procedure and related procedural safeguards. Any behavior intervention strategies shall be designed to enhance the delivery of IEP support. And provide minimal interruption to the academic program. Non-public schools are also required to report all emergencies. So for example, a fire on your school premises or a student testing positive for COVID-19 to the sending LEA and OSSE, and to do so in as timely a manner as possible. Next slide, please. So in short, the COA regulations that govern the operation of OSSE-approved non-public schools include a number of provisions designed to ensure student safety, most notably those related to reporting that we've just spoken about, and the appropriate use of allowable behavioral interventions, particularly emergency behavioral interventions, such as restraints and seclusions. Next slide, please. So here you can see some of OSSE's expectations outlined, in particular those that relate to safety measures. OSSE expects non-public schools to have policies and procedures in place that ensure that student safety is protected and that students are educated in a safe environment that is conducive to learning. Should a student be excluded from in-person learning due to a positive COVID-19 test result, for example, or exposure to someone who has tested positive, the non-public school and LEA are expected to work together to ensure that the student receives continuous education via virtual platforms and experiences as few to no interruptions in teaching and learning as possible. Non-public schools are expected to follow all applicable and the most recently issued health guidelines by state and federal agencies. So by your states, if your school is located outside of the district, your state's Department of Health and the CDC. OSSE expects non-public schools to partner and communicate with the sending LEAs and parents to ensure they are familiar with the strategies being implemented to reduce the spread of COVID-19, specifically maintaining a safe environment through the use of masks and or social distancing and the impositions of quarantine and isolations as appropriate. OSSE also expects non-publics to review and revise as appropriate your school's crisis, preparedness, and response plans, and provide copies of those updated plans to OSSE. Next slide, please. Okay, so as mentioned earlier, non-public schools are required to report emergencies to OSSE, and this includes reporting all cases of positive COVID-19 test results via the incident reporting module in QuickBase that many of you are familiar with. The incident report should include information indicating whether your school has notified the parent, the sending LEA, and your state's Department of Health. Next slide, please. And whether the student has been excluded from in-person learning to protect other students from contracting COVID, and whether distance teaching and learning will be made available to the student for the duration of the student's exclusion from in-person teaching and learning. And as we just heard, that there are some challenges to providing the related services virtually at this time. We also want to hear about cases that do not involve DC students, but with any of personally identifiable information, of course, withheld. Those cases should be reported via email to your designated non-public program monitor. So again, Tony Lemons or LaShonda Wilson. Since these cases cannot be reported through the incident reporting module, since the incident reporting in the module is student-based, DC student-based, you can't enter a record for a non-DC student. So please send the email to your designated monitor. Next slide, please. Please also include in that report about any positive COVID-19 cases, the number of DC students who are currently placed in your school, the total number of individuals who have tested positive, so students both DC and non-DC, as well as staff members, and a description of the strategies currently in place to reduce the spread of the disease. Okay, so I think now I'll turn the presentation back over to Dr. Stewart, who will share some resources on safety measures.
So from the OSSE website that I referred to earlier, we wanted to just call out some specific school safety measure resources that are there. And these are live links again to those specific resources. In the OSSE guidance, there's a health and safety guidance for our non-public schools that we call your attention to in terms of, and also school and health and safety resources. And these documents, again, look at mitigation strategies, look at things like social distancing, plans to deal with positive COVID exposure. Again, all of you are already involved in this, but we wanted to call out this information to see, to help you understand kind of OSSE's thinking on these topics. Again, here is the overall coronavirus website, as well as specific COVID-19 resource pages as it relates to larger CDC information, and specifically with information about COVID-19 in general and how schools and childcare facilities should be planning for and dealing with COVID-specific situations. Okay, so I'm going to turn this over to Ms. Yvonne Smith to talk about licensure. I know we've already gotten into licensure to some degree, and it's likely that this is going to be an ongoing conversation for us, and a bit of a dialogue where certain concerns are raised by non-public schools, and we are able to kind of share those with our leadership and hopefully provide you with updated guidance. Ms. Yvonne Smith.
Okay, before we go into, there's a question on what form are we uploading in the incident report module for positive COVID cases?
You could use the OSSE's incident reporting form. and you would check the type of incident as an emergency and fill out the form, or we also accept your school's internal incident reporting form.
Yeah, and for either the internal reporting form or the OSSE incident form, as Ms. Powell shared earlier in this presentation, this is the information that should be reported. And we're happy to follow up with you individually if you have more specific questions.
Okay, back to licensure. Again, we did walk through this, and basically what this means that for you guys is that if you don't have a DC license, you cannot provide related services to students who are on virtual means. So again, we talked about, there's basically two scenarios: either a student doing virtual because they're on quarantine, which hopefully is just a temporary period of service, maybe about 10 days, 7 to 10 days or so. And then you do have students who have a longer term waiver to receive services virtually because they've filled out the waiver form with the LEA for medical or whatever reasons was approved. So again, you guys have asked these questions, and yes, it does mean you cannot provide services to a student who is on virtual learning when they are located at home in DC if you, the provider, have a license that's outside of DC. To be able to provide those services, you would have to have a DC license. So for those quarantine students, we recommend for now that you just, do makeup services, or, your school can opt to get, you all can opt to get a DC license if you wish. But other than that, that's how we have to proceed. And then you should talk to your LEA about the students who have the longer term waiver been granted to them for that. So what you can do to be able to still get that student what they need. Okay, next slide. So now we're going to get into attendance and payment and invoice submission. You guys should be familiar with that. But if you guys remember, during the height of the COVID outbreak back in 2020, we created special attendance codes that apply to virtual learning. So those were the HE, the PE, and those types of codes that you used: PE, HE, EA, UX. Now that we're mostly back, full in person, you're still expected to take attendance and move forward with that. So we have both now the standard seats codes and some COVID related or the public emergency related codes. Next slide, Eka. So in doing so, you'll have to be conscious of this. You should use the regular seats codes for all in-person attendance. If a student has to go virtual, you should use those COVID codes that we created. Next slide, I'll give you a sample of what that would look like. So here are all the codes. So when you're doing in-person learning, the codes in the left column would be used. Those would be your regular seats codes. However, if a student has to switch to virtual, you would use the codes on the right here, which were the COVID-19 codes that we created. So again, if a student is on quarantine and is attending virtually, you would use the codes on the right, the public emergency codes, while that student is in that on those quarantine days. However, I'm not sure how many of you are still providing, are able to provide services while on quarantine. If the student is on quarantine and absent, and you're not given any services, then you would just use the student is excused absence, the COVID excused absence, that EA. Okay, I hope that's clear. So basically, you use the in person when on the left, the regular seats code when everything is in person. Anytime a student has to switch to virtual, you would utilize the codes on the right for whatever the incident matches. Okay, are there any questions? I see a couple of questions. Edgar or Sharon, can you read and see if there was any questions regarding this? Because
Yeah.
I can't see the whole questions.
Let's see, the first one. Okay, that question about the interstate compact was already addressed. Who are we supposed to notify of non-DC positive? And is that staff and students? Sharon, if you want to take that question, I'll go back to that slide.
Sure. So the question was who should be notified or how? So the notification, if it does not involve, if the positive test result does not involve DC student, we ask that you provide that information via email to your designated OSSE non-public monitor, so either Tony Lemons or LaShonda Wilson, and include these pieces of information: the total number of DC students who are currently placed in your non-public school, the total number of individuals who have tested positive, so that we have a sense of how widespread the positive testing is, and then a description of any the mitigation strategies that are currently in place.
Okay, thank you. I think that's it.
Okay. Okay, so slide 28, right after. If you guys have any questions about seats, attendance coding, you can give my team a call at any time. Contact me or Sandra Bryant or Olanda Muhammad with questions about that. Again, as you know, we moved to an online invoice submission portal, so all invoices should be submitted online through this portal. It's very simple to use. You've been using it for about a year now, and I think everybody's on board with that, but just wanted to remind you that that's being utilized. Try to scan all your documents together and as one document, and don't submit them as separate pages, because they'll end up being submitted as individual inputs, and we can't guarantee that we'll be able to collate them back together. So please scan them, create one document with multiple pages, and then load it up. Okay, next slide. So basically, for the 21-22 school year, we will continue to remit payment for all services that are listed on the student's IEP. So these are the following guidelines basically for this school year. You should have your continuous education plan on file with OSSE and the LEA for this school year. You should complete the non-public questionnaire by November 1st, the CEPs by November 15th. And remember, so very important, and we've been doing this for a while, you have to have a service tracker in place in SEDS to be able to get paid for related services. So I know my team goes back and forth with many of you, and we'll remind you, and we'll let you know when the service trackers do not match what you're billing. So for every service that you're going to bill to OSSE on your invoice, there must be a corresponding service tracker in SEDS there. Also, please remember when you're logging in your service trackers to complete the final step and create the tracker itself, because you start out doing the wizard, the log, and then at some point you have to push the button to create the actual service tracker itself. Okay, also on that, you have to put in your attendance logs, you know, submit your attendance with all your invoices, and we've completed about basically all the rate reviews for this school year. We have a few that are still outstanding, but most schools are done. We also asked, since we've ended the fiscal year with September 30th, that you all get all your invoices in through September as soon as possible. If you can get them in before the end of this month by October 30th, that'll be great. But we do need to process all those invoices through September so that we can guarantee your payment. Okay, that's it.
Yvonne, sorry, can you see this? Can you see the invoice funding and payment slide?
Yes, that's there now.
All right. Yep, just bumped up. So there's a question here that I think I missed before. Not sure if my question was seen about the HE code for seats. This issue has been resolved, but lately, when trying to use the HE code for students who are distance learning, it automatically changes all students to that same code for that day.
Oh, okay. So what you'd have to do is, we're trying to work on that since we kind of reverting back to the in-person, most attendance is in-person. So you would have to override it. You'd have to override it and put that back. So unfortunately, that's probably a pain in the neck. I'm not sure if you put in the regular code for present first, and then you enter, let it, no, it is, since the COVID, the HE takes the precedent. So you would have to put in the HE and then go back and override the rest of them. We are aware of that and we are working on that. I apologize for that for now, because they would have been.
So who should they contact if they're trying to kind of work on it, like, you know, actively, and they want to just kind of talk that through with somebody?
Yeah, you can contact our seats coordinator, Jackie Corsi, for that.
And her information will be at the is listed at the end of this presentation.
Yeah.
Okay.
So that's it. I mean, basically, you would have to let it auto-populate and then go back and override the rest of them. But yeah, Jackie's information, I believe her email is in the presentation at the end.
Yep, that's at the end. Next question. We have frequently experienced times where it takes months to get access to a student in order to create trackers. What do you recommend we do in these situations? Yvonne, you want to start with that one?
Well, I mean, that's between you and your LEA. The LEA has to give you access to the student. So you need to work with your LEA to get that done. There's steps that both of you have to complete in order to make to provide you that full access. So a lot of times if the LEA hasn't done their last step, it won't show up for you. So I'm not sure if your issue is that you have contacted the LEA and they're not responding, or you're just having technical difficulties, but you do have to work with your LEA to get that to access to SEDS.
Yeah. So what I would add to that is that if you feel like you have worked with your LEA and you've run into a dead end, please reach out to your assigned non-public monitor, either LaShonda Wilson or Tony Lemons, and also you can reach out to me as well to kind of help troubleshoot, but only really if you've already worked with your LEA and you feel like you've kind of hit a dead end. In the meantime, what you can do is if you have your own service tracker or a progress note form, you can, through some kind of secure email service, send those trackers to those LEAs and say, until we're able to get this SEDS access issue resolved, we're sending you these, related service trackers for our students. And, what you might want to do is to copy your assigned monitor to flag and make them aware that, you are making attempts to get that documentation to the LEA while you're trying to work out whatever the access issues are.
Yeah. And for us, for invoicing purposes, once you've been contacted that service trackers are missing, if you can't turn it around rather quickly, it's just best to remove the billing items from the invoice, and you can bill it the next month when you do have it all together, because you don't want to hold up your invoice, unless you can quickly resolve that, the missing service trackers.
Okay, we'll go to the next, and this is back to Sharon.
Okay. So here on this slide, you see a number of the main systems that our approved non-public schools use. If you need any support in accessing or navigating or using any of these systems, so SEDS, our DC Special Education Data System, Squire, the Staff Qualification Repository, the Incident Reporting Module, SEATS, or DC CATS, reach out to the point of contact listed here. So Jackie Corsi for Squire and SEATS, myself for the Incident Reporting Module, and Megan Williams for DC CATS. For SEDS, please submit a ticket through the OSSE support tool, the OST. If you don't have access to the support tool, reach out to your school's non-public SEDS POC. If that individual does not know, they should reach out to the LEA SPED POC from the sending LEA. And if you're not sure who the LEA SPED POC for a sending LEA is, please reach out to me or one of the assigned monitors, and we'll get you that information. Next slide, please.
I would just add, and if you're not sure who your non-public SEDS POC is, reach out to your assigned OSSE non-public monitor or Sharon Powell.
Yep.
Did you say next slide, Sharon?
Yes, please. Okay, so here we are, incident reporting again. So regarding incident reporting, non-public schools, as previously mentioned, are required to report emergencies to OSSE. Since the beginning of the 2018-19 school year and the introduction of new reporting requirements, non-public schools are required to also report incidents involving the use of an emergency behavioral intervention, so restraints and seclusions, to OSSE, as well as all cases of suspected child abuse and neglect. And then also the incident reports should be uploaded within 1 business day. Next slide, please. Non-public schools are required to document student attendance in SEATS, so the special education attendance tracking system. Non-public schools should continue to flag truancy issues for the sending LEA by sending the LEA a notification whenever a student accrues 5 days of unexcused absences, and then another follow-up notification if a student reaches 10 days of unexcused absences. Non-public schools should also continue to enter information about staff credentials, including criminal background and child protective registry checks, professional certifications, and our licenses and restraint training certifications into Squire. Next slide, please. And please be sure to document the delivery of related services by completing service trackers in SEDS or by sending related service records to the sending LEA in a timely manner. Also, please be sure to include the delivery modality, whether it's in person or virtual. And again, if you encounter any issues, first reach out to your non-public, the SEDS POC at your non-public school for assistance, and yeah, and reach out to us if you're not sure who that is. Next slide, please. And then here, please be reminded that any non-compliance that is identified by OSSE in a monitoring report in DC CATS, that must be corrected as soon as possible and within the established timeframes. And another just general reminder that all OSSE approved non-public schools should continue to adhere to the regulatory requirements in the COA regs, and they can be found in the DCMR, the District of Columbia Municipal Regulations, under Chapter 28, Title 5, subsection A, and we can provide a copy of that chapter. So I think with that, I'll turn it back over to Dr. Stewart for some wrap up and Q&A.
Yeah, thank you, Sharon. So we wanted to identify the resources that we refer to in this slide deck. So again, you know, on the OSSE website, there's OSSE guidance, including health and safety guidance for the recovery period, formula allocations as well, and school and health safety resources. The overall OSSE website for coronavirus resources is listed here, as well as CDC resources. Our contact information for the three of us is listed here as well. And as we said before, Jackie Corsi and for Seats and Squire, her contact information is listed on a previous slide, as well as Megan Williams for the DC Corrective Action Tracking System. Really, at this point, we wanted to just open it up to any questions that you all might have. And this is, you know, from non-public schools or LEAs. We thank you all for your participation, and we're going to keep the line open so that any questions that you have, we can answer before we end. At this point, it's 10:54, so we're likely giving you back 30 minutes of your time.
There is a question there, says they think they missed it, but they want to know virtual students can or cannot be taught by a non-DC licensed teacher. This is in regards to related services. You must have a DC license to provide related services to a student in DC who is on virtual learning for whatever reason. If, for example, your speech person, Johnny has speech, Johnny's on quarantine, the speech provider doesn't have a DC license, therefore they cannot provide speech therapy to Johnny while he's on quarantine receiving virtual services. If there's someone on your staff that does have a DC license for speech, they can provide that service to Johnny while he's on virtual learning. But again, in the quarantine situation, you know, that's a temporary period of time. You can still, you know, provide makeup services at a later time when the student does come back to school in person. It's the situations where you have students who have received a waiver for medical or other reasons that are going to be on virtual learning for longer terms. And that's where we suggest you talk to your LEA about a plan for that situation. And we'll keep you updated as this changes. You know, this is coming from the DC Department of Health. We ask that you do send us information, you know, on your issues regarding this situation, and we can share them with our colleagues so that we can assess the impact. We're not sure how many students are virtual, you know, currently, you know, both quarantine and or medical, so we're not sure how often this is affecting you.
All right, there's another question. Thank you, Yvonne. If we have a DC funded student who resides in Maryland, can we deliver related services? I'm not sure where the school is located. If it's in Maryland, then the answer would be yes.
They're saying They're saying the student resides in Maryland. Student, we wouldn't have a student.
In a group home, Yvonne?
Oh, okay. So that would probably be like a CFSA or DYRS situation?
Yeah, I think what I would suggest is you contact them. You can either contact me or Yvonne.
Yeah, with specifics.
Because it sounds like a very individual type of answer. Should or can the student's distance learning plan include documentation about related services not being able to be provided by teletherapy? Should we do a prior written notice or both?
Read that scenario again.
Should or can the student's distance learning plan include documentation about related services not being able to be provided via teletherapy? Should we do a prior written notice or both?
Okay, if you are documenting, every time a student goes to virtual learning, yeah, that would be something to include in there to denote whether or not you have a DC license and whether the services can be provided. And it wouldn't hurt to put it in a PWN as well, whatever document you're using.
All right, next question. I think I missed the answer to my question. And I think we were answering it to related service provider. Virtual students can or cannot be taught by a non-DC licensed teacher.
Yeah, we answered that.
No, we didn't. We answered it as it relates to related service providers. They're asking about teachers.
Oh, okay, teachers.
As long as the teacher has a license in the jurisdiction where the school is located, I guess maybe I'm not sure of the question. So virtual students. So this would be a student who's at home virtually receiving instruction being taught by a teacher in another state who's appropriately licensed. Is that the way you would interpret the question, Sharon and Yvonne?
Yes. Yeah, the regs say that the teacher has to be licensed in the state where the school is located. We've sought guidance for programs that even prior to COVID that provide distance learning. And yeah, that's something that we are still, working on getting a definitive answer on.
So we don't have guidance for this question at this time.
Right.
Okay. All right. That looks like all the questions that have been raised. Let me just go back through it one more time. Yeah, I think that's all the questions. All right, well, I think that's it. We give you back 30 minutes of your time. Thank you. If you have any questions, please feel free to reach out to Sharon Powell, Yvonne Smith, or myself about this presentation. Again, you can download for the next couple of minutes the handout, but we will be sending the full slide deck to all the attendees on this website shortly. So thank you again, and we look forward to being in touch with you later this year. And this website will end.
Thank you.
Thank you.